Hello, hi again.
Hello.
Uh,
Hi.
so this is Emily and Dr. Pejic again. We're doing episode 2 of Questions from the Waiting Room. As a recap, these are questions people might be too scared or anxious to ask their psychiatrist in person, so they ask online. So I'm ready to start whenever you are.
Yes, I'm ready.
All right. Dorothy Odom from Aberdeen, North Dakota says, I have a mental illness. I'm about to start my first job. Should I tell my coworkers?
Um, The quick answer I would say is no. And the reason for that is you never know folks' response. I think it's good to develop those relationships and kind of have a slow burn in developing those relationships and a kind of a level of trust. Also, mental illness can mean a lot of different things and may be misunderstood. I think there's a stigma about mental illness out there, obviously, and and so if someone has generalized anxiety disorder, that can be mental illness, right? But so could schizophrenia. So I think it's good just to keep it professional until something happens that where someone may need to take time off and they have a level of comfort with the person, like with their employee. They may want to share that, but that would be if they, trust a person. And it might be good for someone's mental health to have people at work that kind of understand what someone's going through, of course. I just wouldn't do it too quickly. And like if somebody had a job interview for a job, I wouldn't lead with that in the interview either. I would just keep it professional. And then along the way, if it was warranted, like say somebody had bad depression and needed to do ECT, then that stands for electroconvulsive therapy. Then they would probably tell their boss or the HR at their work, listen, I need some time off for this. And there's something called the Family Medical Leave Act, which allows folks to seek treatment for anything and protects their time at work. And that's a form that like a doctor would fill out on behalf of their patient. So that's kind of my take on that.
Yeah, that's good advice. Aaron Blanche from Aurora, Illinois. He wants to know, I'm too embarrassed to tell my psychiatrist about my drug use. Do I even need to?
Yeah, absolutely. I think it's imperative that patients tell their doctor about any substances they're using. And a lot of times, I run into this with patients. They want their psychiatrist to like them and things like that. And if the doctor does not have that information about their patient, it can confuse the treatment planning. For example, if someone's using cocaine intermittently and they come in and tell their doctor, like, I'm not doing well throughout the weeks and I'm having ups and downs, the doctor might misinterpret that information as being bipolar disorder when really it's cocaine use disorder. And you can have cocaine use disorder plus bipolar disorder, but that's a whole different discussion, once cocaine enters the picture. Here in New Orleans, a lot of our patients joke that they drink, and like drinking is ubiquitous, like alcohol, which it's really not. I know lots of patients who are totally sober, and lots of people are sober. But I mean, think of it. You can drink heavily on a Saturday night and still be recovering on a Monday morning. And if you see your psychiatrist then and you're feeling funky, patients will often say, "Well, oh yeah, I had 3 beers on Saturday night." And in my mind, I'm thinking that's probably not causing their Monday morning problem. But if they'd minimized and they really drank like 8 to 12 beers or some scotch or whatever, then it could cause Monday morning problems. So a rule I have is if patients tell me they drink, 4 drinks in a sitting, sometimes I will elevate that number in my mind and try to piece together the timeline of events and see if maybe the substance is causing it, especially if I think somebody's minimizing it to me. And I never judge anybody if they're using something. It's usually indicative that, like in this case, using a substance, it's usually indicative that they're not feeling well or they're leaning on a substance to help get by in life. And once we know that, I can better help them. So I would tell the psychiatrist, now here's the thing, you might meet psychiatrists where it's not a good fit between patient and doctor, and the psychiatrist is judgmental and they are, wagging their finger in an unhelpful way. And if that happened, that's unfortunate. But I would much rather have a patient let the doctor know about their symptoms and their substance use, because we are trained to deal with those types of things. And it's like, what's the point of seeing a psychiatrist anyways, unless you're going to tell him or her what's really going on.
Do you take breaks in between patients? And if so, what do you do?
I don't typically take breaks between patients scheduled. Like in other words, it's not unusual to see 7 people back to back, 4 people back to back for about a half an hour or 45 minutes a piece. But in between, sometimes I'll need to check on phone calls that came in between patients for urgent messages. Like, say I get a text message that there's an urgent refill, somebody's waiting in a pharmacy. So sometimes I'll go talk to our staff about that, and I'll say, hey, what needs to be done right now? Sometimes you take a bathroom break. I'm a big coffee drinker, so I love to grab a cup of coffee, especially if I've been in my office for 2 or 3 hours and I haven't done that. I'll go and grab one real quick and then come right back. I don't really do too much doom scrolling. If a patient's late, I'll probably just do paperwork. So it's nothing glamorous.
All right, I'm going to go back into the deeper questions. All right, do you feel that being a psychiatrist affects your relationships in your day-to-day life? So you find yourself analyzing your friend's family? And this is from Stephen Marks from Richmond, Virginia.
Stephen Marks. Well, it's interesting. So I'm married to a psychologist, and if we're arguing about something, we'll maybe joke that we're acting personality disordered or something like that. And I'm just being real. Like, and if you're married, you're going to argue. Sometimes you're all going to argue about stuff. And I'm a pretty type A fellow, and my wife's not a pushover, even though she seems real sweet on the surface. But she, so like analyzing each other or like other family members, I think the quick answer to that, like, it's like, no, like a lot of times my brain is just shut off from thinking about work when I'm with other people. And that's only because when you work in mental health so much all day, every day, you kind of get your fill, and I'm no longer cutting my teeth in the development of becoming a psychiatrist. You're just doing it, right? So when you're doing it for years and years and years and years, you kind of just turn it off. Now, sometimes I will turn it on if somebody's acting bizarrely, like if I'm out in public, if someone's like having like, say they're talking to themselves or something and they look like they may need help, I might start thinking like a psychiatrist. Sometimes I'll find somebody passed out in New Orleans, like on the sidewalk, and you turn into doctor mode and you start to think about that. But if I'm around family and friends, I don't really analyze like any behavior, because it's not really fair to them, and you don't always have all the relevant information. That's one of the weird things I would say is, when you're with your family, you only know half the story. Whereas as a psychiatrist, I have their blood work. I know what they're putting in the substances they may be using. I know their social history. They're like, if they have ever been abused or not. And in a family, that's not like normal stuff to talk about all the time, depending on your comfort level with like your siblings and your parents, So the answer is probably not so much.
Okay, good.
Yeah.
That's a good answer then.
Yeah.
All right. So one last deeper question. So on gender biases in psychiatry and psychology,
Who's this from?
Hmm?
Who's this one from?
This is gonna be from Sean Smith from Chicago, Illinois.
Okay.
So he wants to know, do you find many people who become misdiagnosed or improperly diagnosed is because of their gender?
Wait, I don't understand the question.
So it's about gender biases in psychology and psychiatry. So
Okay.
if someone, I guess a woman,
Oh, I see.
they're more emotional, do they get misdiagnosed because they one day are just more weepy, let's say?
Oh, uh, no, not. I mean, not personally. For me, I'm never thinking that so much. Um, I think if anything, we might omit like PTSD, for example. If I asked a woman about PTSD symptoms versus a man, I think some men may not admit certain things because they don't want to appear weak. Where I think some women I've treated are more open with their feelings,
Mhm.
but that's certainly not the rule. So if anything, I'm kind of hunting for symptoms in both genders equally, um, because we know that everybody can have anything, like any diagnosis. We also screen people here, where we gather a lot of information that the patient reports to us even before I sit down with them. So I can look at those, and a lot of times patients will tell me less in the session, but they'll tell me more on paper,
Got it.
or vice versa, or they'll admit less on paper, but they'll tell me more to my face in a helpful way of like what is going on in their brain. And then I'll ask them like, why is there a discrepancy between the paper and what you're telling me right now? And that's kind of part of the evaluation that I do. Um, there are situations where one's race, there's something in psychiatry where sometimes folks who are African American might be diagnosed less with bipolar disorder and more with schizophrenia. I don't have the actual number in my head of like what that percentage would be, but those two disorders can look similar, and I think there's a racial bias where sometimes doctors will misdiagnose, you know, that disorder. Um, I can't tell you why exactly, but that's something I recall from my training.
Okay. Okay. Um, I'm gonna end on a more strange question.
Oh no,
Dana Pohl.
Dana Bull.
Yep, Alexandria, Louisiana.
Oh,
So from here. All right. Do you notice any differences in your patients when it's a full moon?
oh my goodness, that's a really cool question. Uh, Man, no, not in outpatient psychiatry, but there is something about that because when you work in inpatient psychiatry and in the emergency room, I think ER doctors and emergency psychiatry doctors who actually do shift work in the hospital probably do see something there. Um, and I don't know what that is. Now you could say it's like the thing where the weather's nice, so everybody's out and about, and then more people get injured, so then more people come to the hospital. For full moon, um, maybe it's just lighter out at night because the moon's full and it's illuminating more, and people are out, or maybe there's something to it because there is that gravitational pull. So I don't know.
Okay. We'll just leave that one as it is.
These questions, man,
Yeah.
it's pretty good. Pretty good.
I think it's pretty good. Yeah, I
Yeah.
like these ones.
Yeah. Very good.
Okay, well, I'm gonna let you go see patients now.
Okay. Thanks very
Um,
much. I'll see you next time.